And today my topic is usage of erbium lasers in endodontical treatment. So some introduction about that. Successful root canal treatment depends on the cleaning and disinfecting the root canal. So our study aimed to evaluate the effectiveness of laser-activated irrigation using Erbium YAG, which is 2,940 nanometers. So the purpose of root canal disinfection is to remove the tissue remnants, bacterial biofilms, and the smell layer. The smell layer is actually formed during mechanical instrumentations of root canal and covers the canal's walls. So when we have patients with a diagnosis of pulpitis or we are doing treatment of root canals as well. So we have smell layer on our dentine walls, and aim for the dentist is maximum to clean effectively, that we will do the obturation is it will be a good quality treatment. So the smell layer contains microorganisms, necrotic tissues, and dentinal remnant. This layer constitutes an obstacle to the delivery of irrigants and chemical agents to the root canal system and creates barrier between the root canal surfaces and filling materials. Removal of smell layer and debris provides better sealing of filling materials to the root canal surfaces. Many irrigants and chemical agents were used to remove the smell layer, such as sodium hypochlorite, EDTA, citric acid, and chlorhexidine gluconate 2%. Many studies have investigated these agents in removing the smell layer. They demonstrated that they have a limited capacity in removing the smell layer from the dentinal walls, especially from the apical third of the root canal. This has prompted researchers to investigate the efficiency of laser in different wavelengths and various parameters in endodontic treatment for removing the smell layer and disinfecting the root canal. It has proved that laser in combination with irrigants can penetrate the dentinal walls better than using irrigants alone and reach to all parts of root canal. Here we can see that the practitioner dentist is always, it's a huge challenge to disinfect maximally the apical first, because to reach there not always possible, and each patient and each has his own anatomy. So, and it's not always straight. And actually the lasers with combination with irrigant solution and sometimes double wavelength concept, when we are using Erbium YAG with 2,940 nanometers or Erbium chromium YSGG 2,780, in combination with diode lasers, 940 nanometers, without any chemical irrigant, just with only with distillate water, we have a really great rate of follow-up and success of the treatment. Erbium chromium YSGG laser, which was approved by FDI, has proved their efficiency in non-surgical endodontic treatment. It provides the most suitable wavelength, as I already mentioned, 2,940 and 2,780 nanometers for cleaning and disinfection the root canal. Erbium YAG laser acts through photoablation with minimum thermal effects on the dentinal hard tissue, and the laser energy is absorbed by water molecules. Different studies have conducted to evaluate the efficiency of Erbium YAG with different protocols and different parameters and various tips alone or in combination with irrigants, and they proved that its combination results in removing the smell layer, eliminating the bacteria, opening the dentine tubules, and that leads to better seal of filling materials. So the aim of our study was to evaluate the effectiveness of laser-activated irrigation. So we use Erbium YAG laser with EDTA, 70% in removing the smell layer and improving endodontical treatment outcomes. For materials and methods, We designed a randomized in vitro study, and which was approved by our university. The study included 90 extracted human teeth after they fulfilled with inclusion criteria. Teeth were extracted due to periodontal diseases or for orthodontic treatments. Teeth have a single root canal and mature apex, and the absence of root resorption or any endodontic treatment which was determined by apical radiographs for each tooth. Teeth were cleaned and stored in physiological saline solution till the experiment. So the root canal preparation, the access cavity was prepared using diamond bores. Teeth apexes were sealed to prevent the falling the arrogance through them. Root canal preparation was done using technique crown down with rotary files. So the first test group number 1, 30 teeth received 10 milliliters of EDTA solution using syringe with 27 gauge, and Erbium laser was applied for 60 seconds through the root canal at the wavelength of 2940. So the parameters were 17 millimeter, 400 conical tip, the repetition rate 10 hertz, the output power 0.5 watt, the energy 40 millijoules. Laser tip was inserted 4-5 millimeter in the root canal. Water cooling was done during the procedure to prevent the dentine overheating. The second group, also 30 teeth, received 10 milliliters of EDTA for 60 seconds using syringe. And the control group, 30 teeth, received 10 milliliter EDTA for 60 seconds and received distillate water using syringe and irrigation, and Erbium laser was applied for 60 seconds as well. The teeth were bisected longitudinally divided, the buccal and lingual segments. So, and the samples were dried and coated with platinum using a spatter column, and we went under the SEM investigation. The evaluation of the SEM was carried out by 2 examiners in a single blind assessment, and the evaluation of small layer removal was recorded according to Halsman. So the score 1, no small layer and dentinal tubules open. Score 2, small amount of small layer and covering the root canal, and many dentinal tubules are opened. The score 3, small layer and debris covering the root canal walls and a few dentinal tubules are open. And score 4, the surface of root canal covered completely with small layer and no dentinal tubules open. And score 5, heavy small layer and debris covered the root canal surface. Statistical analysis. So for comparison between the coronal and test groups, Mann-Whitney tests were used. For comparison between 3 parts of the root canal, Kraskell-Wallis test was used. So, and we can see here in the poster, I tried to put everything, but you know, for the presentation, maybe it will be better to place the information. But here we can see our results under the SEM investigation. So in the group where we just actually used the EDTA, which is ethylene diamine tetraacid acid, 17% for someone who is not similar with dentistry, because we're using it a lot. So in this group where was only EDTA, the small layer removal was higher in coronal region of the root canal than middle and apical regions, which is actually clear because it's just much more easier to reach, as I already mentioned before. So for group where we used EDTA 70% with Erbium YAG together in combination, it was laser activated irrigation. So our samples showed high removable of small layer in all parts of root canal walls, and score 1 was reported in almost 93.3%, in coronal, in the middle 76 and 7%, and the apical region 56 and 7%. So in the group 3, where we used, which was the control group, where we didn't use the EDTA, we just used the distillate water, and we were checking the properties of erbium YAG. We went under the SEM examination, and there was showed the better results of removing the small layer in the coronal and middle thirds of the root canal. So score 1, which is the highest one, was found in 80% in the coronal third, in 68% in the middle third, and just we have the score 2 in, we didn't have score 1, we have only score 2 in the apical third, 44%. So when we compared the scores of root canal removal between coronal, middle, and apical regions, what we can see the root canal is here, and this is the electron microscopy pictures from the coronal, from the middle third, and for the apical third. So actually this group is just distillate water, which was the group 3, distillate water with erbium YAG. Here is the first group was only EDTA, and the second group laser activated irrigation EDTA in combination with erbium YAG. So when we compare the scores of root canal removal between coronal, middle, and the apical regions, so the Kroskal-Wallis test has shown statistical differences in the group. So, and when we analyzed the differences between regions, my Whitney test demonstrated that in group 1, the small layer removal was higher in the coronal regions than apical regions, while no statistical differences was observed between the middle and apical regions in both test groups, in group 1 and group 2. The comparison between groups in the different regions of root canal walls showed statistical differences, which means YAG plus distillate water or EDTA alone. So the golden standard protocol of root canal treatment is to clean and disinfect the root canal by eliminating the microorganisms from infected main and lateral canals. I know that actually I'm here only one doctor, but believe me, the root canal treatment, when you have a pain, even sometimes it's emergency cases, you didn't sleep for all night. And for us, as for dentists, until our days in modern dentistry, it still remains a huge challenge to treat the root canal, to do the endodontical treatment, and that you will not face problems after 5, 6, 7 years when, for example, the non-vital tooth, which went under the endodontical treatment, actually should be covered with crown. So I think you are similar somehow with this procedure. So that's why this is also a challenge for us to make it stable for a long ways. That's why until our days, it's a lot of investigations how to do it. And lasers actually in the modern dentistry shows a really great results. So using the irrigants and chemical agents alone doesn't achieve this goal due to disability of these agents to eliminate the microbes and remove the small layer and debris from the root canal walls. About 30 to 45% of the root canal surface remains untouched by mechanical instrumentations because the nature is very clever. So the role of using irrigants is so compensated to this problem. On the other hand, laser treatment has proved its efficiency in endodontic treatment, and it was demonstrated that erbium YAG laser is the suitable laser for cleaning and disinfecting the root canal due to the absorption function of its wavelength by water and hydroxyapatite without any thermal effect. Erbium laser has been used in different protocols, such as laser-activated irrigation protocol. It's performed using a thin and long sapphire conical tip within the root canal with vertical movements. The mechanism of laser-activated irrigation is a pure cavitation phenomenon which works as pulsed laser operation, causes an expansion and employs Our protocol is photon-initiated photoacoustic streaming tips done by Fatana company, which applied by using a large and short tip with low energy on the access cavity of the root canal to potential as an collapse of the intracanal irrigant followed by hydrodynamic pressure. This pressure pushes the irrigants into the dentinal tubules and lateral canals, leading to clean and remove the small layers and debris. In our study, the LI protocol was used with low energy to evaluate the effectiveness of erbium YAG laser activation. So the same scans showed that this combination was EDTA 70% and erbium YAG removed the small layer in different regions of the root canal. Although the small layer removal in the apical region was less than coronal, this combination has proved its efficiency of creating a clean openal dentinal tubule, and that related the activation of erbium YAG laser to EDTA solution, and that led to increase the efficiency of cleaning action. The same scans at higher magnification, 100,000, in coronal and middle and apical regions showed the efficiency of erbium YAG in removing the small layer, score 1, and opening the dentinal tubules without any thermal effects. These results are inconsistent with the results of which was done by DeVito et al., in which evaluation irradiation times. The study result that samples treated for 40 seconds with erbium YAG laser and the 70% irrigation had the most effective removal of small layer. Also, there were done different research by different foreigners researchers, and they also had great results. Some of them changed the time of activation of solution. Some of them also changed the solution itself. Some of them were using different tips, which also, as from physical part of your laser, also influence on the result. So using erbium YAG laser for activation distillate water was effective in coronal and middle third in our study than apical third, even though it was better than using EDTA 70% alone. And also the same proof results has our researchers. So, and using EDTA 70% alone for cleaning and removing the small layer was less effective than laser. Nevertheless, it could be useful when using it for 1 minute with sodium hypochlorite, which we're using also very oftenly in endodontical treatment, but unfortunately it has cytotoxic effect. And conclusion, what was done in our research, within the limitation of this study, erbium YAG laser has improved the results of root canal disinfection when it was combined with EDTA 70% and distillate water for 1 minute, due to the activation of irrigant inside the root canal without any thermal effect, because for us, as for clinicians, it's very important. The removal of small layer and debris was better in all parts of root canal walls, and that enhances the endodontical treatment. And now we are doing the clinical research as well, but it needs time because we need to do follow-up after 6 months, is after 1 year, and hopefully after the 3 years after the treatment for follow-up with X-ray examination of our patients. Thank you for your attention, and if you have any questions, I'm here to answer. Thank you.